Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download sell ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Treatment of Insomnia in Psychotherapy. Of all the sleep disorders, we are going to emphasize the disorder that we believe is the most important of all. We believe it is the most important of all sleep disorders, as it is possibly the one that appears most frequently among all sleep disorders. We are talking about insomnia, the most common sleep disorder. Insomnia is characterized by difficulties in initiating and maintaining sleep, also by nocturnal awakenings or waking up much earlier than desired, by the sensation of non-restorative sleep, quantity, quality, hours of sleep, etc. Of the sleep disorders, insomnia is probably the most common. There are several types of insomnia. In some cases, the patient has great difficulty falling asleep. In others, the patient can easily fall asleep but wakes up many times during the night, nocturnal awakenings. And in other cases, the problem is that the patient wakes up very early and cannot fall asleep again. All of this may be accompanied by the sensation of non-restorative sleep. Insomnia can be caused by a wide variety of factors, including stress, too much alcohol or too much coffee, excessive alcohol or caffeine intake, substance abuse or withdrawal, various physiological disorders, etc. Insomnia can be a truly frustrating problem, and often the efforts we make to sleep do nothing but aggravate the situation further. Babies sleep about 17 hours a day, which is reduced to 9 or 10 hours as they get older. Most adults need between 7 and 8 hours of sleep each night, although this will decrease as the individual gets older. There are big differences between people to the extent that some people can do well on as little as 3 hours of sleep per night. Older people need less sleep than younger adults and are often awake at night, especially if they have had a nap during the day. We will consider insomnia when sleeping less than 3 hours and normal sleep when sleeping 3 or more hours. Sometimes, giving this explanation to the patient is enough. He or she calms down and stops worrying about how little sleep he or she thought he or she was getting. By being calmer and not worrying about it, the patient sleeps more and better. The 8 hours of sleep is not more than average. Within insomnia, we have 3 main subtypes, accompanied by a 4th subtype that can be present in any of the first 3 subtypes. Conciliation insomnia. Difficulty in initiating sleep. They usually sleep well throughout the night. The problem is that they take a long time to fall asleep. They have difficulty falling asleep when they go to bed. Maintenance insomnia. Difficulty in maintaining sleep throughout the night, usually due to frequent nocturnal awakenings. Terminal insomnia. The patient has no difficulty starting to fall asleep, but wakes up very early, even at night, and cannot fall back to sleep, or has great difficulty in doing so. Feeling of non-restorative sleep. The patient does not have difficulty in initiation or maintaining sleep, but has the feeling of not having had restorative sleep. If you are interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Treatment of Insomnia in Psychotherapy, Part 2. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download sell ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.